You've probably tried everything, right? You've done the stretches, you've attempted those workout routines that are supposed to strengthen your core, maybe you've even invested in expensive equipment or paid for physical therapy sessions. But here's the thing that nobody really talks about openly. Sometimes exercise isn't the answer, and sometimes it can even make things worse, especially when you're in the middle of an acute pain episode. Let me paint you a picture that might sound familiar. It's 7 in the morning, your alarm goes off, and the very first thing you feel isn't that groggy sleepiness we all experience, it's that sharp, shooting pain in your lower back that immediately reminds you that today is going to be another challenging day. You try to get out of bed, and every single movement feels like you're walking on broken glass. Your back is screaming at you, and the last thing on earth you want to do is drop down and do some planks or go for a jog around the neighborhood. This is exactly why today's video is so important, because I'm going to share with you some immediate relief techniques that don't require you to push through pain, don't require any special equipment, and definitely don't require you to force your body into positions that might make everything worse. These are methods that work with your body's natural healing mechanisms, not against them. First, let's talk about why traditional exercise advice often falls short when you're dealing with acute back pain. When your back is inflamed and your muscles are in spasm, trying to strengthen them through conventional exercise is like trying to build a house on a foundation that's currently shifting. Your nervous system is already in high alert mode, your muscles are contracted and protective, and your pain receptors are firing like crazy. Adding more stress to this system through exercise can actually perpetuate the cycle of pain and inflammation. The key to instant relief lies in understanding that your back pain isn't just about your back. I know that sounds counterintuitive, but stay with me here. Your entire body is connected through fascial networks, muscle chains, and neurological pathways. When your back hurts, it's often because other parts of your body aren't doing their job properly, forcing your back to compensate and overwork. So let's dive into the first technique that can give you immediate relief, and this one might surprise you. We're going to start with your breathing. Now, before you roll your eyes and think this is just some new age nonsense, hear me out because there's solid science behind this. When you're in pain, your breathing automatically becomes shallow and restricted. You start breathing primarily with your chest and shoulders rather than your diaphragm, and this creates a cascade of problems throughout your entire body. Here's what I want you to do right now, whether you're sitting or lying down. Place one hand on your chest and one hand on your belly just below your rib cage. I want you to breathe in slowly through your nose for a count of 4, and as you do this, focus on making the hand on your belly rise while keeping the hand on your chest relatively still. Hold that breath for just a moment, then exhale slowly through your mouth for a count of 6, allowing your belly to fall naturally. What's happening here is that you're activating your parasympathetic nervous system, which is your body's rest and repair mode. This type of breathing also gently massages your internal organs and helps relax the deep stabilizing muscles of your core, including the diaphragm, pelvic floor, and multifidus muscles that support your spine. Do this for just 2 to 3 minutes, and I guarantee you'll start to feel some tension melting away. The second technique involves something called positional release, and this is where we work smarter, not harder. Instead of forcing your body into positions that might aggravate your pain, we're going to find positions that allow your nervous system to calm down and your muscles to naturally relax. If you're dealing with lower back pain, try this. Lie down on your back on a comfortable surface, maybe your bed or a carpeted floor. Bend your knees and place your feet flat on the ground, about hip-width apart. Now, gently let your knees fall together so they're touching and supporting each other. Place a pillow or cushion under your knees if that feels more comfortable. The key here is to find a position where your back feels the most relief, even if it's just a tiny bit better. Once you find that sweet spot, just stay there. Don't move, don't stretch, don't try to make it better. Just rest in that position and focus on your breathing. What you're doing is giving your nervous system permission to down-regulate. You're telling your brain that you're safe and that it doesn't need to keep those muscles contracted in protective mode. For those dealing with upper back and neck pain, try this variation. Lie on your back and place a rolled-up towel under your neck, supporting the natural curve of your cervical spine. Let your arms rest comfortably at your sides, palms facing up. Sometimes placing a small pillow under your knees can also help by reducing any strain on your lower back that might be contributing to tension further up your spine. Now, While you're in these comfortable positions, let's talk about the third technique, which involves gentle self-massage using nothing more than a tennis ball or even just your own hands. The goal here isn't deep tissue work that might aggravate your pain, but rather gentle stimulation that can help interrupt pain signals and promote blood flow. If you're lying on your back, you can place a tennis ball between your back and the floor, positioning it next to your spine, not directly on it. The pressure should be gentle and comfortable. If it causes any increase in pain, either move the ball to a different position or remove it altogether. The idea is to apply just enough pressure to create a gentle massage effect as you breathe and allow your body weight to do the work. For upper back tension, you can use your opposite hand to gently massage the area where your neck meets your shoulder. Use small circular motions with just enough pressure to feel good. Remember, we're not trying to dig into knots or force anything to release. We're simply providing gentle input that can help your nervous system relax. The fourth technique is something I call thermal therapy, and this is where temperature becomes your friend. Both heat and cold have powerful effects on pain perception and muscle function, but you need to know when to use which one.
If your pain is acute and there might be inflammation involved, which is often the case with sudden onset back pain or pain that's worse in the morning, cold therapy can be incredibly helpful. You can use a bag of frozen peas wrapped in a thin towel or even a cold pack if you have one. Apply it to the area for about 10 to 15 minutes at a time. The cold helps reduce inflammation and can actually numb pain signals temporarily. On the other hand, if your pain is more chronic or if it's associated with muscle tightness and stiffness, gentle heat can work wonders. This could be a heating pad on a low setting, a warm bath, or even just a warm towel applied to the area. Heat increases blood flow, helps muscles relax, and can make you feel more comfortable overall. Here's a pro tip that many people don't know. You can actually alternate between heat and cold for even better results. Start with cold for about 10 minutes, then switch to heat for 10 minutes, then back to cold. This creates a pumping action in your blood vessels that can help reduce inflammation while promoting healing. The fifth technique involves what I call mindful movement, which is completely different from exercise. While exercise typically involves repetition, effort, and pushing through discomfort, mindful movement is about gentle exploration and listening to your body's feedback. Start by simply noticing how your body feels in whatever position you're currently in. Then, make the smallest possible movements that feel good. This might be gently tilting your pelvis forward and back while lying down, or slowly turning your head from side to side if you're dealing with neck pain. The key is to move only within your comfort zone and to stop immediately if anything increases your pain. One particularly effective mindful movement is what I call the pelvic clock. While lying on your back with your knees bent, imagine your pelvis is the face of a clock. 12 o'clock is toward your head, 6 o'clock is toward your feet. Gently and slowly, tilt your pelvis toward 12 o'clock, then toward 6 o'clock, then toward 3 o'clock and 9 o'clock. These tiny movements can help mobilize your lower back without causing strain. The sixth and perhaps most important technique is learning to work with your nervous system rather than against it. Pain is essentially your brain's alarm system, and when that alarm has been going off for a long time, your nervous system becomes hypersensitive. Everything starts to feel like a threat, and your muscles remain contracted even when they don't need to be. This is where something called grounding can be incredibly powerful. Grounding involves connecting with your environment in a way that signals safety to your nervous system. You can do this by focusing on your 5 senses. Notice 5 things you can see, 4 things you can hear, 3 things you can feel or touch, 2 things you can smell, and 1 thing you can taste. This simple exercise can help shift your nervous system out of fight or flight mode and into a more relaxed state. Another way to work with your nervous system is through gentle vocalization. I know this might sound strange, but making soft humming sounds or even just gentle sighs can actually help activate your vagus nerve, which is a key component of your parasympathetic nervous system. The vibrations from humming can also provide gentle internal massage to tense muscles. Now, let's talk about hydration and nutrition, because what you put into your body can significantly impact your pain levels. Dehydration can increase muscle tension and make pain worse, so make sure you're drinking enough water throughout the day. But here's something most people don't realize. The timing of your hydration matters too. Drinking small amounts of water consistently throughout the day is much more effective than trying to chug large amounts all at once. When it comes to nutrition, certain foods can either promote or reduce inflammation in your body. Foods high in omega-3 fatty acids, like fatty fish, walnuts, and flax seeds, have natural anti-inflammatory properties. On the flip side, processed foods, excessive sugar, and foods high in trans fats can increase inflammation and potentially make your pain worse. Sleep quality is another crucial factor that directly impacts your pain levels. Poor sleep can lower your pain threshold and make everything hurt more. If your back pain is interfering with your sleep, try creating a sleep environment that supports your spine. This might mean placing a pillow between your knees if you sleep on your side, or under your knees if you sleep on your back. The temperature of your sleeping environment matters too. A room that's too warm can increase inflammation, while a room that's too cold can cause muscles to contract. Most people sleep best in a room that's between 65 and 68 degrees Fahrenheit. As we wrap up, I want to emphasize that these techniques work best when used together, not in isolation. Your body is a complex system, and addressing pain requires a holistic approach that considers your nervous system, your breathing, your positioning, your environment, and your overall well-being. Remember, the goal isn't to push through pain or to force your body to do things it's not ready for. The goal is to create conditions that allow your body's natural healing mechanisms to work effectively. Sometimes, the most powerful thing you can do is simply stop fighting your pain and start working with your body instead. I hope these techniques provide you with some immediate relief and give you a different perspective on managing back pain. If you found this video helpful, please give it a thumbs up and let me know in the comments which technique worked best for you. Don't forget to subscribe if you haven't already, and I'll see you in the next video where we'll dive even deeper into natural pain management strategies. Take care of yourselves, and remember, you have more control over your pain than you might think.